Greetings, it's Dr. Russell, and I wanted to answer one of the most common concerns for our medication assisted weight loss clients, and that is the concern of giving yourself subcutaneous injections, which is really quite easy, but understandably can be daunting if you've never done it before. So, I'm going to show you how we do it, how we recommend that you do it at home, and it doesn't really require much supplies. So, I have all the supplies that you're going to need that should be arriving with your medications. One is an insulin syringe marked in units. 10 units is 1/10 of a milliliter, but the dosing should be in units, and I would follow that based on whatever your concentration of medication is. And the concentration of medication should be listed on the vial. It's very important that you pay attention to the concentration and that it matches, because some are much more concentrated, and you'd want to make sure that you're not giving yourself extra medication based on a change in the concentration. So be attentive to that. And then you have alcohol swabs, so 2 of them for this, and potentially you might need a bandage, but there usually isn't much bleeding. So you're going to begin with opening the first alcohol swab and prepping the top of the medication. So this is a vial that's already been opened. They're going to initially come to you sealed. You pop the cap off and throw that cap away. Then after you've thrown the cap away, you wipe the alcohol swab across the top of that. And while that's drying, you take the second alcohol swab and expose an area on your stomach that's just a few inches away from your belly button or umbilicus on either side. So I go about 2 to 3 fingers to the side of my belly button, prep the skin, and then while that area is drying and the area has dried now on the vial, you take your insulin syringe and carefully remove the plunger cap and the cap over the needle. So we're going to imagine we're doing a 10-unit injection. So you're going to draw back to 10 on the syringe and have it just full of air at this point. You're going to invert the medication and at 90 degrees, so straight up, push the needle into the center of the medication, push that air in, and then now pull back, and you should be pulling the medication out easily. And now that is 10 units. Because the skin has already been prepped, you can move directly to giving yourself that injection at the site that was already prepped. Hopefully your skin has not been touched by clothing, so I'd remove any clothing from the area and then give yourself the injection at a 90-degree angle. At that point, at that point, you're gonna have the needle, rather than capping it, I should say, throw it directly into your sharps container. And that pretty much is the whole process.